What if the surgery your doctor is recommending could actually make your life worse? Not because your doctor is wrong or careless or doesn't care about you, but because there are things about your body, your age, and your specific health profile that never make it into the conversation. I've spent over 2 decades inside operating rooms. I've held beating hearts in my hands, and I'm telling you right now, there are 5 surgeries that carry hidden risks for people over 60 that almost nobody is talking about. Stay with me, because what you're about to hear could change a decision that changes everything. My name is Dr. Sarah Kevin. I'm a cardiothoracic surgeon, and I started counting the patients who walked into hospitals for routine procedures and walked out permanently changed. Not better. Changed. A man who came in with back pain and left unable to walk. A woman who survived open-heart surgery but lost 6 months of her life to complications nobody warned her about. These aren't horror stories, they're patterns. And once you see the pattern, you cannot unsee it. Here's what medicine got wrong for decades. A 70-year-old body is not a 40-year-old body. Sounds obvious, right? And yet, surgical protocols, recovery timelines, and success benchmarks were built treating them the same. When an older body goes under general anesthesia, the heart works harder, the lungs clear slower, the kidneys struggle with medications, and the brain, this is the one that shocks people. The brain becomes temporarily disoriented in ways that can last weeks or even months. Doctors call it post-operative cognitive dysfunction. In patients over 70, it happens far more often than anyone admits. Age alone is not the enemy. I have operated on 80-year-olds who bounce back faster than some 50-year-olds. The real word you need to understand is frailty. Frailty means the body's reserve has dropped below a critical threshold. Nearly 40% of people over 75 are clinically frail. Over 85, that number climbs to 60%. The question is never just can they survive the operation. The question is, can they survive the recovery? Those are 2 completely different things. So let's get into it. Open heart surgery in frail patients is the first one. Coronary artery bypass surgery works beautifully for the right patient. But here's what nobody puts in the brochure. Your heart is stopped completely during the procedure. A machine breathes and pumps for you. For a healthy 60-year-old, that's manageable. For a 78-year-old with kidney disease and mild cognitive decline, that bypass machine is hitting every organ in your body at once. Studies show frail elderly patients face a 30 to 40% risk of major complications from this surgery. Up to 15% do not survive the first 30 days. Ask your surgeon one question before you sign anything. Am I a candidate for a less invasive approach? A catheter-based procedure called TAVI exists that never requires stopping the heart or opening the chest. That question alone could change your entire path. The second surgery is aggressive spinal fusion. Back pain in your 60s and 70s is almost universal, and surgeons are recommending fusions more and more, hardware inserted up and down the spine, multi-level decompressions. Now, some spinal surgery is absolutely necessary. A spinal cord being actively compressed causing paralysis needs immediate intervention. But elective spinal fusion for chronic back pain? A major study found complication rates exceeding 40% in patients over 65. Blood clots, infections, hardware failure. And the part that genuinely frustrates me, the pain relief from aggressive surgery is no better than physical therapy and targeted injections for many elderly patients. No better, but with dramatically higher risk. If anyone has ever told you surgery is your only option for back pain, write that in the comments. You deserve to know there are other doors. Third is major cancer surgery. When someone hears the word cancer, the instinct is immediate. Cut it out, remove it. And I understand that completely. But 2 decades in surgery has taught me that the goal of treatment is not just to remove the tumor. The goal is to give the patient more good years of life. Pancreatic cancer surgery, for example, takes 6 to 10 hours and removes multiple organs at once. In a healthy younger patient, it can be life-saving. In an 80-year-old with heart disease, the surgery may technically succeed, and the patient still passes away within weeks, not from cancer, but from the operation itself. Ask your oncologist directly. If we don't operate, what does radiation, targeted therapy, or watchful waiting look like for someone my age? That question opens a door many patients never knew existed. Fourth, elective joint replacement in severely ill patients. Hip and knee replacements are among the most successful surgeries ever developed. For the right patient, a new hip is life-changing. But in patients over 75 with multiple conditions like heart disease, diabetes, and kidney disease, elective joint replacement carries significantly elevated risks. Blood clots, pneumonia from reduced mobility, hospital-acquired infections. The question isn't whether to ever have the surgery, it's whether your body is in the best condition right now to handle it. Optimizing your blood sugar, blood pressure, and cardiovascular health before surgery can dramatically reduce complication rates. Some hospitals now require a formal prehabilitation program before scheduling these operations for high-risk elderly patients. Ask if yours does. Fifth is emergency abdominal surgery. You don't choose this one, it chooses you. But knowing the risks before an emergency happens changes how families make decisions in those terrifying midnight moments. Emergency abdominal surgery in patients over 75 carries mortality rates of 30 to 50% in severe cases. The best thing you can do is catch problems early, never ignore persistent abdominal pain, and have an honest conversation with your family now about your wishes. Not in a hospital corridor under fluorescent lights. Now, at the kitchen table. Before any major surgery, ask these 4 questions. What happens if I don't have this surgery? Is there a less invasive alternative? What does recovery realistically look like for my specific health profile? And what is your personal complication rate for this procedure in patients over 70? Surgeons know their numbers. An honest one will tell you. If that question makes them uncomfortable, that itself is information worth having. A surgical recommendation is not a verdict. It is the beginning of a conversation. The surgeon holds the scalpel, but you hold the choice. And that choice, made with full information and clear eyes, is the most powerful tool in medicine. If this gave you something to think about, share it with someone you love. It might be the most important thing you do today. This is BioWell Hub. Stay informed, stay empowered, and we'll see you in the next one.